Like I told you in my previous video, baldness, if it is hereditary, it is bound to happen, but there are different modalities by which you can stop the process of miniaturization. So the first and the most common medicine that is prescribed and which has a very good results is the minoxidil, and every one of you is mostly aware of it. So it's a vasodilator. It increases the vasculature of around the hair follicles and increases the nutrients going to the hair follicles. It has a property to stop hair fall as well as to cause hair growth if you continue it for a certain amount of time. The second most important molecule that is used is finasteride. It is a 5-alpha reductase inhibitor, and like I told you in my previous video that there is increased conversion of testosterone to dihydrotestosterone. So it will inhibit that, and it will not allow dihydrotestosterone to accumulate. So this is also giving very good results for reducing hair fall as well as causing hair regrowth. There is a lot of hype created about the side effect profile of these 5-alpha reductase inhibitors, and that is why it has come in the topical form also. But whatever it is generally reversible. There are other in-office procedures which we do in our OPDs and has got very good results, and it's giving us very promising results for hair regrowth. So let me go step by step. So the first treatment that we have is a triple LT. It's a low laser light treatment. It has got specific amount of diodes in the laser treatment areas, and that particular wavelength will stimulate your hair regrowth. That can be done twice to thrice weekly, and it can be done in the OPD, or else it's very comfortable to do it in the confines of your home also. The second most common treatment is stem cell therapy. We have certain ready-made nutrient formulations which we try to incorporate in your scalp with the help of certain collagen induction treatment, and that has got also very good results. Basically, they don't contain stem cells. They have the property to stimulate the stem cells that are already present in the hair bulb of your hair follicle. The third treatment that is picking up trend is the PRP. That's a platelet-rich plasma treatment. Platelet-rich plasma is nothing but it is a component of your blood. When we draw your blood, we take a small amount of your blood, we centrifuge it, and as you know, blood contains RBCs, WBCs, and platelets. It is the platelets that we're concerned with, and that is what we extract from your blood, and that is reintroduced into your scalp. Ideally, it is to be injected in the treatment areas, in the defective areas, but people who are not comfortable with the injections, we also micro needle it into the scalp. That is also giving us very good results. And we do it as a monotherapy, or else we're getting very good results if we're combining it with stem cell treatment. Next treatment that we have is a fibroblast growth factor. That is also a medicated serum that is also used along with the collagen induction treatments, and it can be alternated with the PRP treatment. New treatment that is picking up trend is PDO grow hair treatment. So like I've discussed in the previous treatments, so they are all they're all a form of collagen induction treatments, wherein your body is forced to bring a lot of growth factors in the treatment areas. They are all sessions, and there is a gap between two sessions, and the gap can be anywhere between 15 days to a month. Whereas so you can imagine that whatever induction we are doing, still we are getting very good results. So just imagine if there is a type of procedure we could do which will give you continuous stimulation to your body to form a lot of growth factors, how exponential the results are going to get. And that is why we have introduced the PDO Grow hair treatments, and that is introducing very fine, even finer than your normal threads, and into the bald areas, and that is going to continuously give stimulation to your body to form a lot of growth factors, a lot of collagen, to increase the vasculature around the hair follicles, and to ultimately lead to new hair regrowth. The last treatment is the hair transplantation. It is also one of the good treatments that you can opt for, especially if you have very less amount of time in hand, or you don't have the patience to undergo all these treatments. So all these treatments that I mentioned over here are available at our center, that is West Avenue Medical Center. If you have any doubts, if you have any queries, please mention it in the comment box below, and I'll make it a point to answer all those queries. Thank you. Hi, this is Dr. Ayesha Faizan. I'm a consultant dermatologist and practicing cosmetologist psychologist at West Avenue Medical Center.